Top 30 Medical Receptionist Interview Questions and Answers. Welcome to our guide on the top 30 medical receptionist interview questions and answers. Whether you're applying for your first receptionist role or bringing years of experience, this list will help you prepare confidently. We've compiled the most common and important questions you're likely to face, along with effective sample answers to help you impress your interviewers. Get ready to boost your communication, multitasking, and patient service skills with this comprehensive preparation guide. 1. Tell me about yourself and your experience as a receptionist. I'm an organized, empathetic, and service-oriented professional with over 3 years of experience as a receptionist in both general and medical offices. My background includes managing multi-line phone systems, scheduling patient appointments, maintaining records, and ensuring a welcoming front desk experience. I thrive in busy environments, balancing administrative responsibilities while providing compassionate service to every patient. My experience with electronic health records and insurance verification has made me efficient and detail-oriented. I take pride in my ability to communicate clearly and calmly with patients of all ages and needs. I'm excited to bring my skills to your healthcare team. 2. Why do you want to work as a medical receptionist? I want to work as a medical receptionist because it combines my administrative strengths with my passion for helping others. Being the first point of contact in a healthcare setting is a meaningful role. I enjoy making patients feel comfortable and ensuring they receive timely, professional care. The healthcare field offers an environment where I can contribute to people's well-being while applying my skills in organization, communication, and multitasking. I find fulfillment in providing excellent service and supporting both patients and healthcare providers to ensure operations run smoothly and efficiently every day. 3. What do you know about our clinic/hospital? I understand your clinic is well regarded for its patient-centered care and commitment to using modern technology to enhance service delivery. Your facility offers a range of specialized medical services and has built a strong reputation for professional staff and compassionate care. I've read positive reviews about your emphasis on timely appointments, thorough follow-ups, and your dedication to improving patient outcomes. I'm particularly impressed by your investment in both staff training and digital tools to streamline administrative work. I believe this commitment to excellence aligns with my professional values and goals as a medical receptionist. 4. How do you handle a high volume of calls and walk-in patients simultaneously? When managing high volumes of calls and walk-ins, I remain calm, prioritize tasks, and follow established protocols. I greet walk-ins with a friendly welcome, quickly assess their needs, and log their arrival. For incoming calls, I use a professional tone, answer promptly, and place callers on hold if needed, always checking back frequently. I make use of digital scheduling tools to stay organized and update patient records in real time. Clear communication, teamwork, and time management are crucial. I also flag urgent matters for immediate attention and ensure no patient feels ignored, even during peak hours. 5. How do you prioritize tasks during a busy shift? I start each shift with a mental checklist and adjust priorities as the day unfolds. Patient care always comes first, checking in arrivals, assisting walk-ins, and answering urgent calls. Administrative tasks like updating records or processing insurance follow once immediate needs are addressed. I use scheduling software to track appointments and alerts, and I flag tasks by urgency. I communicate with clinical staff to stay aligned on their priorities too. By staying organized, remaining adaptable, and taking brief notes as reminders, I ensure nothing gets missed, even during hectic periods. 6. What software or scheduling systems have you used? I've worked with several scheduling and EHR systems, including Epic, Cerner, and Cario. These tools have helped me manage patient appointments, track check-ins and checkouts, and verify insurance information efficiently. I'm proficient in calendar syncing, appointment reminders, and managing cancellations or reschedules. Additionally, I've used Microsoft Office Suite for documentation and email communication. I learn new software quickly and stay updated on system upgrades. I understand how important accuracy and speed are in scheduling and billing, and these platforms have allowed me to provide seamless service to both patients and the medical staff. 7. How do you maintain patient confidentiality and data privacy? I strictly follow HIPAA regulations and internal clinic policies to ensure all patient information remains confidential. I never discuss personal health details in public areas and make sure screens and documents are not visible to unauthorized individuals. I log out of systems when stepping away and shred any printed materials containing sensitive data that are no longer needed. I'm also cautious with phone calls, verifying patient identities before disclosing any information. Training and awareness play a big role. I consistently stay informed on privacy best practices to ensure trust and legal compliance in every interaction. 8. How would you handle a difficult or irate patient at the front desk? I would remain calm, listen actively, and show empathy to understand their concerns. I would avoid arguing and instead reassure the patient that I'm here to help. If possible, I'd resolve the issue immediately, whether it's about a scheduling error, billing confusion, or long wait times. If the matter requires further support, I'd politely escalate it to the appropriate staff. Throughout, I maintain a respectful tone, using de-escalation techniques to prevent conflict. I understand that patients may be in pain or stress, so I focus on maintaining professionalism and restoring a positive environment. 9. Describe your experience with medical billing or insurance verification. I've handled insurance verification by contacting providers to confirm coverage, collecting copays, and ensuring pre-authorizations when necessary. I'm experienced with both private insurance and government plans like Medicare and Medicaid. I've used billing modules within systems like Cario and Athena Health to process claims, input diagnostic codes, and follow up on unpaid bills. I'm familiar with EOBs and insurance denials, and I communicate clearly with patients about their responsibilities. Accuracy is key. I double-check information to prevent errors that can delay care or payment. My goal is to support smooth billing for both the clinic and patient. 10. How do you ensure accuracy when booking appointments? I double-check all details when booking: patient name, date of birth, preferred provider, service type, and insurance status. I confirm appointments verbally and send written reminders when possible. I use color coding or tagging features in the scheduling system to highlight special needs or follow-ups. If there are unclear or incomplete referrals, I reach out for clarification before finalizing bookings. I review the day's schedule at the start of each shift to identify potential overlaps or issues. Accuracy builds patient trust and helps keep the medical team's day running smoothly, so I take this responsibility seriously. 11. Have you handled sensitive or emergency situations? What did you do? Yes, I've encountered sensitive situations, such as patients collapsing in the lobby or distressed individuals seeking urgent care. In one case, a patient fainted at check-in. I quickly alerted the nurse on duty, cleared the area, and stayed calm to reassure others. For emotional distress or confidential disclosures, I guide the patient to a private space and notify the appropriate staff discreetly. My training in basic first aid and emergency procedures helps me stay composed. I understand the importance of responding swiftly, maintaining confidentiality, and supporting both patients and the medical team during such moments. 12. How do you handle stress in a fast-paced environment? I stay calm under pressure by maintaining a structured approach and focusing on one task at a time. I use to-do lists and prioritize urgent needs, such as walk-ins or phone calls, without losing sight of ongoing tasks. Breathing techniques and short mental resets help me stay grounded during especially busy periods. I also rely on teamwork, communicating openly with colleagues to divide responsibilities when needed. Staying organized, thinking ahead, and focusing on solutions instead of problems allows me to handle stress positively and maintain a welcoming atmosphere for patients, even on the busiest days. 13. How do you stay organized throughout the day? I rely on digital tools and written checklists to track appointments, patient arrivals, calls, and administrative tasks. I categorize responsibilities by urgency and use calendar reminders for time-sensitive actions. I ensure that paperwork, forms, and office supplies are stocked and labeled for easy access. Throughout the day, I regularly check and update the schedule, flag any changes, and keep a clean workspace to minimize errors. Communication with team members helps avoid overlapping duties. Staying organized not only improves efficiency but also allows me to provide a calm, Professional front desk experience for all visitors. 14. Describe your communication skills with doctors, nurses, and patients. I communicate clearly and respectfully, tailoring my tone and approach depending on the audience. With patients, I use friendly, empathetic language to explain procedures, answer questions, and provide reassurance. With doctors and nurses, I'm concise and professional, sharing relevant information quickly and accurately to avoid disruptions. I'm attentive to nonverbal cues and handle sensitive discussions with discretion. I actively listen, repeat details when necessary, and ask clarifying questions to ensure mutual understanding. Strong communication builds trust, prevents miscommunication, and enhances workflow across the clinic. I take pride in being a reliable point of contact for everyone. 15. What steps do you take to maintain a clean and welcoming reception area? I believe the reception area sets the tone for the patient experience. I ensure surfaces are sanitized regularly, magazines are neatly arranged, and signage is clear and up to date. I restock brochures, forms, and pens as needed and ensure there are tissues and hand sanitizer available. I promptly report any maintenance issues, such as lighting or HVAC problems. I greet each patient with a smile and keep the waiting area calm by managing wait times and providing updates. A clean, organized, and friendly space helps patients feel comfortable and valued from the moment they walk in. 16. How do you handle a double-booked appointment or scheduling error? If I notice a double booking, I review the urgency and nature of both appointments. I first check if any patient is flexible or if the provider can extend their time. I promptly call the affected patient to apologize, explain the situation politely, and offer the next best available slot or suggest an alternative provider if possible. I always aim to resolve the issue calmly and professionally. To prevent recurrence, I review scheduling logs regularly and use software alerts to flag overlaps. Communication, transparency, and problem-solving are key to maintaining trust and smooth operations. 17. What's your experience with electronic health records, EHR? I've worked extensively with EHR systems like Epic, Athena Health, and NextGen. My responsibilities included updating patient demographics, entering visit notes, uploading scanned documents, and verifying insurance details. I ensure data is accurate and complete for each patient before their appointment. I also assist with accessing lab results or past visit summaries when requested. I'm familiar with managing patient portals and helping patients navigate them. My EHR proficiency helps streamline front desk tasks and supports clinical staff with quick and reliable access to essential information. I stay current with any EHR updates or system changes through training and hands-on use. 18. How do you verify patient identity and insurance coverage? I follow a strict verification process at check-in. I ask patients to present a government-issued photo ID and their insurance card, ensuring names, birth dates, and policy numbers match our records. I use the clinic system or insurance portals to confirm eligibility, coverage details, and copay amounts before services are rendered. If discrepancies arise, I clarify them directly with the insurer or guide the patient on resolving them. I also confirm if referrals or pre-authorizations are needed. This careful approach prevents claim denials, reduces billing issues, and ensures that patients are informed about their coverage upfront. 19. How do you handle confidential paperwork and files? I handle all confidential paperwork with care and in compliance with HIPAA regulations. I store files in locked cabinets or restricted access folders when not in use and ensure that only authorized personnel can access them. When disposing of documents, I use a shredder or secure disposal bin. I never leave sensitive information unattended on desks or printers. If I must transfer paperwork internally, I do so discreetly and securely. I also remind staff and patients to respect privacy when handling forms. Protecting patient data is a priority, and I take every precaution to uphold confidentiality. 20. What would you do if a patient refuses to pay a copay or bill? If a patient refuses to pay, I remain calm and professional. I first explain the billing policy, referencing any signed financial agreements, and verify that the amount is accurate. If they still refuse, I inform them of their options, such as setting up a payment plan or speaking with the billing department. I document the conversation and alert the appropriate staff if needed. I never argue or escalate the situation. Instead, I focus on offering solutions while maintaining a respectful tone. It's important to balance empathy with policy enforcement to preserve the patient relationship and office procedures. 21. How would you respond if a patient arrives late for their appointment? If a patient arrives late, I first assess how late they are and check with the provider about possible accommodations. If the schedule allows, I inform the patient we'll still see them, possibly with a short wait. If it's too late to keep the appointment, I apologize kindly, explain the policy, and offer to reschedule at the earliest convenience. I emphasize that we value their time and want to ensure quality care. My goal is to remain respectful and flexible while keeping the provider's schedule on track and minimizing disruption for other patients. 22. Describe your experience managing incoming and outgoing mail or emails. In my previous roles, I was responsible for sorting, distributing, and responding to incoming emails and physical mail. For incoming correspondence, I prioritized time-sensitive items like referrals, lab results, or insurance notices and forwarded them to the appropriate departments promptly. Outgoing communication included appointment reminders, follow-up instructions, and patient forms. I maintained logs for important documents, ensured HIPAA compliance, and used templates for clarity and efficiency. I also monitored the front desk inbox throughout the day to keep response times short. Clear and organized communication helps the clinic run smoothly and keeps patients well informed. 23. How do you manage phone etiquette, especially with anxious or elderly patients? I answer the phone promptly with a calm, friendly tone and always identify the clinic and myself. For anxious or elderly patients, I speak slowly, use clear language, and confirm that they understand the information. I practice active listening, give them time to explain their concerns, and avoid rushing the conversation. If needed, I repeat key details and offer to follow up via mail or email. I maintain patience and empathy, making them feel heard and supported. Positive phone etiquette is vital in healthcare. It builds trust and reassures patients even before they walk through the door. 24. How do you handle no-shows or frequent cancellations? I track patient attendance patterns through the scheduling system and flag repeat no-shows for follow-up. If a patient misses an appointment, I reach out to reschedule and remind them of the clinic's cancellation policy. For frequent cancellations, I communicate with them to understand the issue and offer solutions like reminder calls or flexible scheduling. I document all communication and report patterns to management if needed. Preventing no-shows improves clinic efficiency, so I also send appointment confirmations via call, text, or email. My approach is proactive, respectful, and focused on helping patients keep their care on track. 25. Can you multitask while remaining professional and courteous? Absolutely. In my experience, multitasking is a daily part of the role. Handling calls, checking in patients, managing schedules, and assisting with forms all at once. I stay organized by prioritizing tasks, using notes and reminders, and staying focused even under pressure. I make sure each patient or caller feels they have my full attention, even when managing multiple duties. I use polite, clear communication and a calm tone to maintain professionalism. I also know when to ask for support from coworkers during peak times. My multitasking skills ensure smooth front desk operations and a positive experience for everyone. 26. Describe your role in supporting doctors or medical staff. As a medical receptionist, I play a crucial support role for doctors and clinical staff. I manage appointment scheduling to prevent overlaps and ensure proper time allocation based on visit type. I prepare daily schedules, update EHRs with patient information, and relay messages or lab results when needed. I also help ensure patient flow is smooth, minimizing delays. By handling administrative duties efficiently, like verifying insurance, organizing forms, and directing inquiries, I free up clinicians to focus on patient care. My goal is to create a seamless bridge between patients and medical professionals for better overall clinic performance. 27. Have you ever dealt with a medical emergency at the front desk? Yes, I've encountered a few emergencies. In one case, a patient arrived with chest pain. I remained calm, immediately alerted the medical team, and followed protocol by helping clear space and reassuring the patient. While the nurses took over, I discreetly informed the waiting patients about the delay. In emergencies, staying composed and acting quickly is vital. I'm trained in basic CPR and emergency procedures, and I always keep emergency contact numbers readily accessible. I understand that my quick action can make a significant difference before professional intervention begins. 28. What would you do if you suspected a patient was under the influence? If I suspected a patient was under the influence, I'd remain calm and professional, ensuring the patient and others around them are safe. I would avoid making assumptions or accusations and instead notify the clinical or supervisory staff immediately for further assessment. I'd follow clinic protocols, which might include rescheduling non-urgent appointments or involving security if behavior becomes disruptive. Patient privacy and dignity are important, so I would handle the situation discreetly and document the incident if required. The key is to manage safety while treating the patient respectfully and within legal and ethical boundaries. 29. How do you ensure patients feel welcomed and respected? I greet each patient with a warm smile and personalized attention, using their name and maintaining eye contact. I listen attentively to their concerns and respond with patience and empathy. I keep my tone friendly, professional, and calm, even when under pressure. I also make sure the waiting area is clean, organized, and comfortable. If delays occur, I keep patients informed to reduce anxiety. I believe every interaction is an opportunity to show care and respect. My goal is to make each patient feel valued and supported from the moment they arrive to the moment they leave. 30. Why should we hire you as our next medical receptionist? You should hire me because I bring a strong combination of administrative expertise, patient service skills, and a compassionate attitude. I'm experienced in scheduling, insurance verification, and EHR systems, and I stay organized even in high-pressure situations. I genuinely care about patients' experiences and take pride in creating a welcoming environment. I'm reliable, a fast learner, and thrive in team-oriented settings. My goal is to support both staff and patients while helping the clinic run smoothly and efficiently. I'm ready to contribute to your mission of delivering high-quality, patient-centered care from the front desk. Thank you for reviewing the top 30 medical receptionist interview questions and answers. We hope these insights give you the edge you need to succeed in your next interview. Stay confident, stay professional, and remember, every great healthcare team starts with a friendly and efficient front desk. Good luck.